Hello everyone, this is Dr. Lori Langdon, board certified pediatrician, mother of 6 and grandmother to 2, here with a quick video about what ear tugging means. Should you be worried? Is this an emergency? So depending on how young your infant is, their ability to intentionally tug on their ears is not so great. So often in younger infants, they have merely discovered their ears as this attachment beside of their head and started playing with it. Some of them even realize it can be soothing to rub their ears, so they may do this in an attempt to self-soothe and help them at night to settle back down, which is a good thing and easier than thumb sucking because it doesn't lead them to need orthodontia later, which is nice, can save you some money on braces. So self-soothing is fine, just discovering the ear is fine. Now, if your child has had no recent nasal congestion, runny nose, cough, fever, I'm really not usually extremely concerned that it is an ear infection. Now, there are exceptions, and there are some babies who can just have an ear infection out of the blue. We sometimes discover these at well visits and still do treat them with antibiotics. So remember how this works. For a genuine ear infection, the baby typically will have upper respiratory infection symptoms, runny nose, cough, congestion, sometimes fever, sometimes not. And then all of that mucus production then leads to a secondary bacterial infection in the ear that is the ear infection that needs antibiotics. So I want you to understand that the tugging alone does not guarantee an ear infection, because I think a lot of parents are surprised when they come in, we look in the ears and the eardrums look just fine. And in that case, they don't need an antibiotic, even if they've had some fever from the viral upper respiratory infection leading to us to worry about the ear infection. Hope that makes sense. So we would still do all the supportive care measures for the cold. And if their ears are hurting, even if they're not infected, you can still do supportive care measures for ear pain, like a warm, wet washcloth, like elevate their head, alternate ibuprofen and Tylenol if the pain is severe. I also want to teach you about the emergency level of ear infections. So the only genuine emergency about an ear infection would be the pain control problem. And so for that, we would do the supportive care measures for ear pain, the same as if they did or didn't have an ear infection. Elevate the head. Certainly for the congestion, if they had it, you could run the cool mist humidifier. You could use a few drops of warmed olive oil in the ear canal, and that can soothe that inflamed tympanic membrane or eardrum. Warm wet washcloth. All of these care measures can help with the pain, which is the only true emergency. Some parents have this mistaken notion that because the child is suddenly in ear pain or tugging, that it's a genuine emergency. I mean, emergency department level emergency at 2 a.m. And it's really not, because if you can control the pain, that's our concern. We'll get the child started on antibiotics just with a routine office sick visit, of course, and then you'll eventually get pain control after those antibiotics begin to work. Now, would you want to just go to the doctor only for the ear tugging? Probably not. If there was no increase in irritability, normal appetite, normal sleeping, normal activity level, no preceding nasal congestion, runny nose, or cough, it is very unlikely that ear tugging alone means that there's an ear infection. So I would not recommend that typically. As always, you have to run this by your child's individual pediatrician and ask about it if you have any concerns. We are always absolutely happy as pediatricians to work your child in just to make sure that their ears are okay. And many of our visits are this way. Please do not be disappointed if you bring your baby in for ear tugging and their ears are not infected. This is a good thing. We truly want to avoid the overuse of antibiotics, especially in younger children. It can have some long-range complications and can select out for more resistant organisms and cause diarrhea and yeast infections and all sort of bad things we don't want to do. So if your baby is happy and not irritable, not congested, and has no fever, I'm not really very worried about ear tugging alone. Hope that was helpful. Thanks.